Hi, I'm Dr. Kurt Woeller for Dr. Tracy Trincatella. We are of Integrative Medicine Academy. The title of this short video is Functional Medicine Mastery Course. What is functional medicine? So the Functional Medicine Mastery Course is a very comprehensive online course designed for healthcare practitioners in the principles of functional medicine, from nutrition to diet, to laboratory testing, to clinical correlation, to investigating complex health disorders that we're commonly seeing in our practice. This particular course is very useful and the information really immediately applicable to clinical practice. So a lot of what we're trained in conventional medicine is how to look at what's called the symptomatic or the medical model. And this is where people come in with a variety of symptoms. And then we're trying to isolate things down, go through a differential diagnosis. And that certainly is a worthwhile approach. From a more functional medicine standpoint has always been this aspect that there's this subclinical model that imbalances in the hormone, gastrointestinal, detoxification, immune system will predate, certain problems that show up in the medical model box. And so from a preventative health standpoint, what we're hoping to do with individuals is not only, one, identify the problem that they're currently dealing with, but then also implementing strategies from a lifestyle, diet, etc., to prevent problems down the road. And a lot of practitioners have heard of integrative medicine. This is the implementation of different types of treatments, whether that's dietary intervention, supplements, diagnostic testing, even natural medicine, but sometimes along with conventional medicine, to try to bring a more comprehensive approach to healthcare. So for example, one of the areas that I work in is what's called biomedical intervention for autism. That in essence could be called integrative medicine for autism. Or you'll have individuals who are doing, let's say functional medicine nutrition or functional medicine testing. Functional diagnostic medicine is another term. And what's interesting is functional medicine really goes back many, many years, even before integrative medicine, the term got popular, because it was the idea to look at or try to determine the underlying root cause of illness. But it was heavily weighted in the integrated systems of detoxification, digestive, hormone, and immune systems. And so functional medicine places a tremendous emphasis on understanding the function of the body as it relates to lifestyle, nutrition, diet, and environmental factors. And then, of course, as time has gone on, there has been more sophisticated lab testing that has allowed us to dig into different types of health problems to a more significant degree. So the chronic stress response is at the core of functional medicine. And whatever that stress is, whether it's environmental, whether it's diet, whether it's geographical, whether it's toxic, even mental emotional stressors are known to have a chemical signal through the hypothalamus, which then speaks to the adrenal glands to produce cortisol. We also get DHEA. And so a discrepancy or imbalance of cortisol, the DHEA over time, can then lead to energy production problems of, let's say, decreased insulin sensitivity, or blood sugar utilization problems, or immune system problems where we start to have a loss of secretory IgA and immune dysregulation. And so the clinical conditions, whether it's depression, whether it's an autoimmune disease, whether it's chronic infections, it all funnels back to this breakdown of the stress response, to where people are dealing with these chronic stress issues. And take that even to a deeper level is understanding now that the imbalance of cortisol and DHEA, just that one element, can influence the nervous system, the musculoskeletal system, the detox capacity at the cellular level, endocrine function like thyroid, for example, even sex hormone imbalances. it can create a scenario of increased inflammation, which then affects the brain, nervous system, cardiovascular system, etc. So let's take a quick example of fatigue. Fatigue is very common. They figure about 1/5 of family medicine patients are presenting with fatigue. A large percent of those are adolescents, certainly within a pediatric population. And men and women will describe fatigue differently. And in about 1/3 of people within the conventional medical model will have no identifiable etiology for their fatigue. And then the differential diagnosis of fatigue is very, very large. And so it's always important to have a broad perspective when you're working with somebody coming in with fatigue. And there's different types of fatigue, from physiologic fatigue, which is generally relieved with rest, to secondary fatigue, which is caused by some underlying or other medical problem, and then chronic fatigue, not relieved by rest, fatigue lasting longer than 6 months. And so physical examination is certainly an important part to make sure we're ruling out major problems from cardiovascular issues or chronic infections or thyroid problems, etc. And then there are many fantastic diagnostic tests. One of the things we certainly would want to rule out anemia, for example, or maybe there's some underlying thyroid problem or perhaps a chronic infection. And then, of course, if we're dealing with somebody with, very severe problems, looking at an echocardiogram, pulmonary function test, etc. But there are many functional medicine lab tests that are also extremely useful. One of those that we discuss within the Functional Medicine Mastery course is the organic acids test, particularly from Great Plains Laboratory, because this particular test looks at organic acids, these compounds that are produced naturally in our body, but also can be produced by microorganisms within our digestive system, from fungal organic acids linked to mold exposure, to candida, to Clostridia bacterial toxins, organic acid imbalances that can indicate mitochondrial problems and energy production, organic acid imbalances that can reflect to neurotransmitter imbalances within the brain and nervous system, and then fatty acid oxidation, nutritional markers, and indicators of detoxification status, which again, these organic acids can be reflective of toxin exposure, poor detox, and all of this can have an impact on, in this one scenario, with somebody with fatigue. And one of the ways it can is these different types of imbalances and toxins can affect mitochondrial function, which the organic acid test can detect. And if we think about the mitochondria as these energy factories within our cells, this is what produces that ATP, that cellular energy currency that runs the machinery of our body. The Krebs cycle, if you remember back to high school biology class, this cycle can be influenced by nutritional deficiencies, by candida toxins, by Clostridia bacteria, by mold, by chemicals. And when we disrupt Krebs cycle function, we're also going to have a negative influence on this thing called the electron transport chain. This is that part of the mitochondria found on the inner mitochondrial membrane that produces the bulk of ATP. Again, that cellular energy currency. And so instead of looking at mitochondrial dysfunction and saying, okay, well, you have a mitochondrial problem, and then trying to just give somebody supplements, what we talk about and what we teach about and why this is so important is to try to figure out the why. Why does somebody have this problem? So functional medicine isn't just about trying to substitute a medication for a supplement. It's about asking the question why and then trying to figure out what's causing it. Is it a nutritional deficiency? Is the mitochondrial problem happening because of the heavy metal toxins? Is it a mold issue? Is it a chemical problem? These are the questions that need to be asked. These are the things that need to be investigated to really, truly practice functional and integrative medicine the way it's meant to be. In fact, if you take it back to the whole aspect of just stress, from a glucocorticoid, cortisol, and then a DHEA imbalance, well, it's known that a problem in those hormones can itself be linked to mitochondrial problems. Go through one more example, gluten. We've all been, taught about celiac disease, right? So somebody has an autoimmune reaction to gluten. It creates disruption along the surface lining of the gut. It can lead to gut problems. In a really severe case, can lead to leaky gut and inflammation. And we know that the surface lining of the gut is not only for absorbing nutrients, but it's also one of the main immune organs, first line immune defense in our body. So our small intestine particularly produces a lot of secretory IgA, which is an important aspect of our immune system. So if we cause this inflammatory autoimmune reaction along the surface lining of our gut, we're not only going to compromise immunity, which then increases the potential for opportunistic infections like Candida, like Clostridia, but it can compromise absorptive surfaces as well. And if this is happening in a child, it can stunt growth. If it's happening in an adult, it could also create weight problems. It can also cause anemia and other types of issues. In fact, sometimes just from a dietary change, this is a table here that's looking at individuals who were on a normal diet, meaning they were eating gluten, and then went on a gluten-free diet, and look at just the change in some of the blood parameters. So in this particular case, the hemoglobin levels went up, okay? This was about a 3-month period of time. Iron levels improved. B12 levels almost tripled just by getting off of gluten in somebody who had celiac disease. And so gluten sensitivity, okay, is another component of gluten reactions. So the gluten sensitivity isn't necessarily causing the same disruption at the gut level. We're not getting that autoimmune type of destruction. But there's been a lot of correlation to gluten sensitivity to things like autism, to even certain types of mental health disorders, seizures. Okay, this is why it's important to be doing food sensitivity testing in patients who are coming in with a wide variety of chronic health issues. This was one article going back a number of years that was looking at neurologic and psychiatric manifestations of celiac disease as well as gluten sensitivity. And this was another author looking at gluten sensitivity as a neurological illness. A lot of people are just assuming it's a gut problem. Well, what they found was they actually found this one case study. This was an individual who developed what was called cerebellar atrophy or gluten ataxia. We can see here over a 15-month period of time, we had a fairly normal looking cerebellum to one that is now inflamed and problematic. And if you think about what the cerebellum does, it's all about proprioception. It helps to keep balance physically, kind of orienting ourselves to space. I actually met a doctor, he was a surgeon, who developed chronic neurological problems. They couldn't figure out what it was. He actually had to stop doing surgery and was eventually diagnosed through his own research, where he went in and discovered that he had cerebellar atrophy due to gluten ataxia. So a fair amount of people who have these types of gluten reactions sometimes don't have any gut problems. The manifestation is occurring elsewhere in the body, like the brain or nervous system. So the Functional Medicine Mastery course, again, is a course that goes through these concepts in depth, starting with basic functional medicine testing and then working up to more complex laboratory testing like chemicals and molds and organic acid testing. And then correlating all of that information back to the clinical presentation of the patient. Now, I'm Dr. Kurt Woeller. I've been involved in clinical education for many years, clinical practice now going back to the late 90s, along with my practice partner, Dr. Trinkatella, who's a licensed naturopathic physician. And our approach to functional medicine is to work at things from a clinical level, to help you as an individual learn how to think clinically and critically as you evaluate an individual from the point of view of functional and integrated medicine. By trying to look, beyond just surface level information, by doing sophisticated testing and putting the data points together and looking to see how things correlate from a functional physiological standpoint. We do provide protocol information in this course, but we also want to and push practitioners to many times think beyond a protocol, because one of the things that happens if you become too protocol oriented is practitioners become too dependent on the protocol, and when the protocol doesn't work, which will happen, sometimes people don't know where to go from there. So our whole point is think critically, think clinically, and understand that a protocol is only as good until the next person it doesn't work on. Then you have to get back to becoming a doctor again and trying to figure out what else to do. And so that is the reality of doing this in practice, is you will have patients where the things that you try to do don't work. And so you have to try and figure out what else to do. So for more information about the Functional Medicine Mastery course, take a look at the homepage of the website at functionalmedicinemasterycourse.com. If you have any questions, you can reach out to us at functionalmedicinemasterycourse@gmail.com. Again, this is Dr. Kurt Woeller for the Functional Medicine Mastery course. Thank you.